I'm Noel,
I'm Jenny.
And I'm Cole.
and we're living overseas on a dime.
That's a Jen. So yeah.
Hi there, it's Noel from Living Overseas on a Dime. I hope you've all kept well recently. It's getting into the spring now, and we're almost done our time here in Sayulita, so we're looking forward to being on the road again. But we have a little bit of a different topic today, and that's health insurance and healthcare. So we just wanted to give you a little bit of an inside look as to what we as a Nomad family have done for our health insurance and how that has worked out in relation to some of the minor healthcare issues we've had. So what do we do for our health insurance? Now, we aren't exactly that old. We're both 48 and our son's only 10. So we haven't had, any major health issues or anything like that, thank God. But so what do we do for our health insurance? Well, we use, like many other nomads, we use the Safety Wing program, which I know some people don't think is necessarily the absolute best, but I don't think it's the worst either. And I think one of the big pluses that Safety Wing has in relation to the current environment is that it has COVID coverage. So if you get COVID, you're covered. Now in the near future, that may not even be necessary. Fingers crossed that this thing goes the way of the dodo bird. Anyways, we're looking forward to when it's not really something we need to be concerned about. So when it comes to Safety Wing, we have 3 policies really. There's 2 adult 48-year-olds, and each of those costs us $68 a month. And then we also have coverage for our 10-year-old son, which costs $42 a month. That's in US dollars for both of those. And that comes out to a total of just close to 180 US dollars per month for the 3 of us. Now, the way that we look at this is it's more emergency coverage than anything, and it's reflected in what it is. So it has a $250 US deductible and $250,000 coverage per incident. Now you may think, oh, well, that's nothing. Well, that may be true in the United States, but to put it in perspective, it generally only costs $20,000 to $25,000 to get a quadruple bypass in Mexico. So to get up to that $250,000 range, even if it's the insurance kind of cost, which is always probably double what self-insured people pay, it's still more than adequate in our minds for what you may encounter. Now, like we said, we kind of treat it's more for emergencies. If you get in a car accident or you fall down a sewer drain or who knows, and I'll tell you, some of those sewer drains in Malaysia, they're impressive, 15-foot deep things. So we definitely treat our health insurance as something that we rely on for emergencies. It's not like for everyday things, and I think you'll see why in a minute when we talk about our self-insured component. So for our everyday issues that may come up, be it gut issues or other sort of minor issues, our view is we are self-insured. Now, what does that mean? Some people might say that's crazy. You're going to go to the doctor. It's going to cost you $500 to see a general practitioner, and then another $100 to $500 for medication. Well, outside of the United States, that's just not true, and especially outside of Europe and into the developing world, it's most definitely not true. Now, you may say, okay, well, that's your opinion. Well, this is our experience. I'll tell you what, we have had a couple of minor health issues since we've been here, and I'll go through them with you and give you exact prices as to what we paid. So first of all, I had some gut issues when we first got here. I've had Giardia before, so I knew very sure that it was Giardia. There are some very telltale signs of that, and I went to the pharmacy, talked to the pharmacist there, who also said that in their belief it was Giardia, and I bought the medication for Giardia, took the dosage, and was completely fine following that. Now, if, say, it wasn't fine after that, then I probably would have gone for some tests, but it was. So you know what? I was very happy with that, and that medication cost a sum total of 55 pesos. So I'll put the amount down here as to actually how much that costs in US and Canadian dollars, but I'll tell you, it's not very much. I think it's something like 3 or 4 Canadian dollars, so like 2 or 3 US dollars for that medication. So it really was not very much. So Jenny had some very minor health concerns that she first went to a general practitioner, and that cost 200 pesos. And then following that, she also had to get a very minor procedure done, which cost around 1,000 pesos. That general practitioner said, you know what, you really should go see a specialist. We contacted the specialist following that, and we were in to see that specialist in under a week, actually within a day. So it gives you an idea as to how quickly you can be referred and see a specialist. Now, this is at a private hospital. It was at CMQ in Nayarit, which is in Bucerias. And so we went to the specialist, and that cost 800 pesos. And then following that, the medication that Jenny needed to take, which was total around 1,000 pesos, but it was quite a few medications. She had a couple different drops that were for 10 days each, as well as an oral antibiotic for almost 2 weeks. So that was 1,000 pesos. I'm not sure if I mentioned that, but yeah, the total of all of that really wasn't as much as we had paid for probably one round of antibiotics in Canada. So it's not really something that we were concerned about cost-wise. Okay, so not talking about cost, because cost, of course, is an important concern with most of us when we're dealing with healthcare, because we're worried it's going to add up really quickly to a heck of a lot of money, talking tens, if not hundreds of thousands of dollars, especially when dealing with Canada, United States, Europe sort of costs. Let's talk about quality of care. Because I know a lot of people are like, well, it's so cheap. Oh my God, the quality of care has to be horrible. And I'm going to tell you, based on our experience, that that has not been the case at all. Not only did we very quickly see the specialist, the quality of care that we received was, in our opinion, it was amazing. The specialist listened to all of our concerns. We gave a detailed history as to what was going on. And then, due to the fact that he was a surgeon, or he is a surgeon, he utilized surgical devices to examine the area that previously had only been used. It was an ear problem. And in the past, it was just used even by the specialist with a regular ear tool. I don't know exactly what it's called, just the scope that they use. Well, he had a surgical microscopic device that he looked in Jenny's ear with. It was amazing, and very quickly diagnosed the problem that for a year doctors in Canada missed. And I truly am amazed and very, very impressed with the quality of care, to say the very least. Now, don't get me wrong. This was our experience. It was a pretty minor ear issue. This isn't cancer. This isn't a heart attack. This isn't any sort of huge issue where, you know, you're going to need multiple rounds of chemotherapy or a quadruple bypass where you're in the hospital for weeks on end or anything like that. But when it comes to minor care, where it's ongoing issues that maybe were missed, you know, I have nothing but good things to say about our experience with the private Mexican healthcare system. Now, I don't know about the public, and I'm just saying based on our experience, but so far with our method, which is self-insuring for the smaller things and using our insurance for more emergent care, I have nothing but positive things to say. Now, hopefully that'll continue to be the case, because this is kind of what we're planning in the future. And you know what? Comment down below. What has your experience been with healthcare in Mexico in particular, and also living overseas? Do you self-insure? What sort of methods do you use while you're traveling? Because I think that health insurance is something that a lot of people overpay with. Or maybe I'm just totally naive and we're underpaying. I don't know. I think that there is kind of a bias with a lot of people who are used to paying so much money for health insurance just because they're used to the cost of medical procedures being so high. Our experience here, that hasn't been the case, and hopefully as things go on, our experience continues to be the norm, because it has been our experience in other countries as well. I had to go for a medical procedure in the Philippines where the care was great. Taiwan, we've had medical procedures. So it's not like this is our first time ever dealing with anything medical. And like I said, I'd really like to hear your comments down below. Like, say what you've experienced. Has it been a lot more money? Has your insurance been easy to claim in these situations? Because we haven't really had to deal with that. We've primarily been self-insured. So I'd really like to hear what you guys have to say out there. So for now, I hope you all stay safe, and I hope this video has been of some help to you in discussing our experience with our healthcare. But stay safe and happy travels.